Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
You've probably at some point in your life experienced what we usually describe as feeling dizzy or dizziness. Today I want to talk about vertigo because there is a distinct difference between vertigo and dizziness. Vertigo is actually a type of dizziness, and dizziness falls into 4 different categories. It can be vertigo, presyncope, equilibrium, and lightheadedness. And vertigo itself is incredibly common as well as incredibly problematic for anyone who has ever experienced this. So I want to go into a little bit of detail about vertigo today and some nutrients that can be beneficial that have been studied in human clinical trials to show their efficacy. So I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk a bit about vertigo. If you have ever experienced vertigo, you know that this is not a fun thing to have. It's a very unpleasant feeling where you feel like the room is spinning on you, or that everything just seems very, very off. Now, many times people who have vertigo, this will kind of resolve on its own. But for some people, this can be a long-term lingering problem that can really affect your day-to-day life. Now, we know that the U.S. adult population, it's estimated that about 40% of people will experience vertigo at least one time in their life. And we also know that women are significantly more at risk for the development of vertigo than men are. And a lot of this can come down to hormones. So we'll talk a bit about that and what you can be doing. We certainly know that there are certain neurological conditions that can cause vertigo. You can look at MS, for example, people who have had a stroke, those who are prone to migraine headaches. And we also know that things like diabetes and arrhythmias certainly can create this symptom of vertigo. So what exactly is vertigo? And the causes in many cases are unknown. So you can look at what is known as benign paroxysmal positional vertigo, and this is probably the more common cause of vertigo. And this occurs when people move their head. And say, for example, you're laying in bed and you turn one way and then you feel like, oh wow, everything kind of feels like it's spinning. That would be an example of benign paroxysmal positional vertigo. Now, this is oftentimes occurring because of these microscopic calcium deposits that are trapped within the semicircular canals within the ear. So we certainly know that this is the most common cause. This oftentimes can resolve on its own. However, we also know that this is usually the primary reason as to why people would go and seek out treatment for vertigo, because if it's lingering for more than a couple of days, this can really start to affect your overall day-to-day functioning. Now, we can also look at Meniere's disease, and we know that Meniere's disease actually results from an imbalance of fluids within the inner ear that actually cause these episodes of vertigo that can last maybe from a few minutes upwards to a few hours. And this also is usually associated with a disruption in hearing as well. So sometimes people will get either a little bit of hearing loss where your hearing's not as acute, or they can experience ringing in the ears or tinnitus. So we know that Meniere's disease is certainly problematic. We can also look at inflammation that occurs within the inner ear that is brought on because of either a viral or a bacterial infection. So there's a lot of different ways in which vertigo can present itself. We certainly recognize through scientific research that supplementation of both vitamin D and calcium can be very, very helpful for people who have the most common form of vertigo, which is that benign paroxysmal positional vertigo. So low vitamin D levels in terms of your serum blood levels have been directly linked to people who have these episodes of the BPPV form of vertigo. So that's that positional one. So you turn your head and the next thing you know, the whole room is kind of spinning on you. And I certainly understand this. I have had quite a few episodes of vertigo throughout my adult life. I remember my worst case was I had to fly in for my sister's wedding, and I was okay that day, but the next day I woke up and felt like the whole room was spinning. And I remember we had to go get our hair done for the wedding, and I was sitting in the chair getting my hair done, and I remember I was just like clinging to the chair because I felt like the entire hair salon was just moving on me. And then we got to the church, and I felt like the whole time I was swaying back and forth. I don't think I was, but that's the way that I felt. I felt like I was just on completely unsteady ground, as people often describe it, like you were on a boat all day and you get off and you have those sea legs, and that is how I felt. And it resolved probably within about 36 hours, but that was a really long 36 hours of feeling like the whole world was spinning around you. And this is a uncomfortable thing. Now that I know more about this, I certainly recognize that at the time it was probably a vitamin D issue for me. And now that I supplement with vitamin D on a everyday basis and I take 5,000 IUs per day, I haven't had any of these episodes. But we do realize that there is this direct causal relation between serum vitamin D levels being low and the exacerbation or the onset of vertigo. Now, we also can look at different medications that can cause this kind of dizziness or vertigo. Remember, vertigo is a way in which dizziness can present itself. So we can look at different antibiotics, certain statin drugs for cholesterol lowering medications, certain antidepressants have been linked to causing vertigo. And we also can look at all of these underlying health conditions, including things like diabetes. We know that abnormal glucose metabolism certainly can create this issue, as well as I mentioned, people who suffer from migraines. And we can look at that hormonal component once again when thinking about that. So looking at the ways in which to approach this, we know for a condition such as Meniere's disease, for example, dietary implications play a really significant role. And, having a low sodium diet for those who have Meniere's is really important, because remember, we're looking at that fluid issue. And then when we look at the positional, then we look at the vitamin D and calcium supplementation. We can also look at coenzyme Q10. We know that people who have congestive heart failure, for example, generally have very low coenzyme Q10 serum blood levels. And when they gave people who have congestive heart failure coenzyme Q10, 73% of them reported an improvement in that sensation of vertigo. So we know that CoQ10 certainly can help to offset that issue. We can look at things like ginger root extract and helping with not only ease the inflammation within the inner ear, but also to offset the issue of nausea that can certainly come up. And so you can even look at our turmeric and ginger formulation as being a really good option for those who have these episodes of vertigo, and how you can go about, really targeting that. So knowing that there's such a wide swath of the population that can experience vertigo. And like I said, it can be limited to a few minutes, to a few hours, to a few days, and for some people, months on end. We really need to address the main driving force. If we know it's a glucose imbalance and trying to regulate blood sugar, if we know that it's a potential medication that you're on for the treatment of your high cholesterol, then maybe speaking with your doctor and saying, hey, ever since I've been on this medication, I keep having these episodes of feeling really dizzy, or that the room is spinning on me, and maybe looking for other medication options for you. But we also have to look at how we create that balance, and understanding that if it is hormonal imbalances, having your blood work done. For women who experience issues with vertigo, going through menopause, for example, is a very common time when vertigo can start to really show its force. And so having your hormone levels assessed so you can create balance once again, looking at that serum vitamin D level certainly is important. Obviously, if someone has a history of chronic diseases such as the diabetes, making sure that that is in check. For those who suffer from migraines, making sure that you are doing the right things in terms of a daily protocol, not only food-wise, but also any medication that your physician may have prescribed to you. And there's so many different lingering things from viral infections such as herpes, for example. We know that acute onset of vertigo can last multiple days after someone has a herpes outbreak. And we can even look at, shingles, for example. We know that a lot of these cases of shingles don't only present in terms of the intense pain that they get in a particular area of the skin, but it can also create issues when it comes to vertigo. So there's a lot of different ways in which we have to, number one, get to that root cause, figure out why this happened, because it's not normal. You shouldn't feel like, the room is spinning on you. If it's a blood pressure issue, is it a problem where every time you're standing up, and we're looking at kind of a orthostatic hypotension, making sure that you're working with your physician so that that does not become a problem moving forward. So there's a lot of different approaches. Definitely having hormone levels tested, having your glucose and insulin levels tested, making sure that your vitamin D level is good, and making sure that you have high antioxidant foods coming in from those healthy fruits and vegetables certainly can make a huge, huge difference. So I just wanted to give you a little introduction on vertigo today, and that is all that I have for you. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health Podcast.